Close to 500 people who underwent a diagnostic procedure at Victoria General Hospital may have been exposed to viral infections, including hepatitis and HIV. The Vancouver Island Health Authority wants to test anyone who underwent endoscopy between June of 2008 and January 2010. One of the endoscopes used in the procedures at Vic General was not properly sterilized. Bacteria that had grown on one endoscope matched a bacterial infection found in a patient who had died from his illness. And now VIHA is reviewing the way it cleans equipment and has sent letters to the people affected, urging them to get tested. A News reporter Louise Hartland has our top story.
For hepatitis B, hep C, or HIV.
Those are examples of blood illnesses the Vancouver Island Health Authority says up to 500 patients may have been exposed to after being treated with a tainted piece of surgical equipment. Vic General made the discovery after staff noticed a cloudiness in a cleaning solution. It's regularly used to sterilize endoscopes, a snake-like diagnostic tool used to examine and detect problems with the liver, pancreas, and gallbladder. They found nothing suspicious in regular screenings, but after a more detailed swab test, staff discovered something much more serious.
During that process, we discovered a small amount of residue in one of the ports on the scope. That's likely to be blood. And that was remaining after the cleaning process was complete.
Specialized staff clean the instruments, but the health authority says the scopes need to be soaked right after a procedure. But that may not have happened in this case, allowing blood to dry.
We have changed our process such that there will not be any drying of the instruments, that they have to be soaked after use. Prior to cleaning.
The health authority says it stopped using the equipment after the discovery in February. Days later, a patient returned to the hospital 3 days after a procedure with a bacterial infection linked to the endoscope.
He was very ill. The procedure was a palliative measure in his case, and we treated his bacterial infection. He went home. He has subsequently died from his illness, not from the bacterial infection.
Bacterial infections present within days of procedures. The concern now is viral infections, which have a much longer incubation period. Those viral infections include hepatitis and HIV. At-risk patients who underwent procedures with one of the 4 suspect scopes would have been operated on between June 2008 and January of this year.
The risks, I would stress that the risks are very low. The risks from the literature are around 1 in 30 million procedures. So we're very unlikely to find any.
BC's health minister says it's unfortunate, but says mistakes do happen.
So what you always have to do is be constantly trying to improve performance, have checks in place, and make sure you're as careful as you can possibly be, but you will never eliminate the risk altogether.
A sentiment echoed by the health authority, which warns this could happen again.
We cannot say that that's 100%, that there is no risk. Neither can we say that this cleaning failure was a single event.
Louise Hartland joins us now with more on the story. Louise, how are these at-risk patients being notified?
Hudson, VIHA says they took their time going over the files of people who underwent the procedure. They've contacted their doctors, and each patient was sent a registered letter from the health authority on Tuesday. Those patients will be given free testing for the viruses they could have contracted.
All right, Louise Hartland reporting. Louise, thank you. Joining us now outside our A News studios to discuss this further is the opposition health critic, Adrian Dix. Mr. Dix, thanks for being with us tonight. The minister and VIHA says, both say that mistakes happen, but shouldn't one assume that if you're having an endoscopy that the equipment has been properly cleaned?
Well, I think it's true mistakes happen. In this case, though, the consequences are pretty serious for the individual who was in fact infected, and pretty serious for the 500 people who received letters from VIHA. You know, we've had serious incidents now at Vic General, at Royal Inland Hospital, and Kamloops with respect to the cleaning and sterilization of equipment in recent months. And I think that raises serious issues. I think people should expect the highest standards. And when VIHA said today in its press conference that these incidents are rare, well, there have been significant incidents over the last few months and significant incidents with respect to infections in our hospitals over recent years. And I think this is an issue, and the standards that clearly need to be higher.
So what needs to be done differently? What would you do differently?
Well, we thought in the election campaign what we need is a Quality Standards Council, and its first task should be to address issues of cleanliness in our hospitals. We've cut the amount we've spent in recent years on cleanliness, and I think the costs of that are very high for patients. You only need a few incidents such as these, and the cost for the healthcare system is higher, and the cost for patients is much higher than that. We have more people in our hospitals today. We do more procedures in a shorter period of time, and I think that investment in cleanliness and sterilization should always be the highest priority. And instead, over recent years, sadly, with respect to cleanliness in particular, we've had lower standards, and I think we need to address that, and we need to address that now.
NDP health critic Adrian Dix, thank you for joining us tonight.
Thank you, Hudson.
If you know or are involved in this and have had the procedure during the period in question, and you think you may have been potentially exposed to a virus, A-News would like to hear from you. Here's how to get a hold of us. Send us an email at islandnews@atv.ca. Give the newsroom a call at 250-414-6510. Toll free 866-242-2484. Or you can contact us via our website at atv.ca.